Hello, my name is Dr. Dewan S. Raja. Today I will discuss about slipped capital femoral epiphysis, also called SCFE. Slipped capital femoral epiphysis is a condition that affects the hip joint, typically occurring in an overweight adolescent between 10 and 17 years during their growth spurts. It occurs both male and female, but boys suffer more than that of the girls. They have more chance to get slipped capital femoral epiphysis. Definition: slipped capital femoral epiphysis occurs when the head, the ball of the femur, slips off the femoral neck because of weakened epiphyseal plate, growth plate, causing pain, stiffness and instability in the hip joint. The epiphysis often dislocates, slips slowly and result in coxa vara. Coxa vara is an abnormality that happens when the angle between the neck of the femur and the shaft of the femur is decreased and the limb is extended outward. Although the trauma is reported in 50% of cases, half of the cases have no obvious traumatic story. What are the causes of slipped capital femoral epiphysis? Okay. The exact cause of slipped capital femoral epiphysis is not known, but several risk factors are associated with this condition. Rapid growth spurt during puberty, obesity which places increased stress on the growth plate, hormonal imbalance or endocrine disorder, that is hypothyroidism, genetic factor or family history, trauma or minor injuries. Symptom: hip, knee or groin pain, limping or difficulty walking, stiffness and limited range of motion in the hip. The affected leg may appear shorter and may turn outward, that is coxa vara. Diagnosis: physical examination to assess pain, range of motion and gait. Imaging studies, X-rays are the primary tool used to diagnose slipped capital femoral epiphysis, following the position of the femoral head relative to the neck. MRI or CT scan may also be used for further evaluation. Okay, so we got the symptom and diagnosis. Okay, symptom: we have hip, knee or groin pain, limping or difficulty walking, stiffness or limited range of motion in the hip, affected leg may appear shorter and may turn outward, that is coxa vara. Okay, so this is the normal femur here. This is the growth plate, also called epiphyseal plate or just physis. This is the femoral head, and this is the shaft of the femur, neck of the femur here. This is the growth plate. There is abnormal. This is the, here we are saying is the slipped capital femoral epiphysis here. So the ball is going down from the neck here. So this is a typical image of slipped capital femoral epiphysis. The femoral head is slipping down and the leg will show the features of coxa vara. Okay, so this may be further down, it may go down further. Okay, it may be a gradual onset, it may be bilateral, usually unilateral. It happens to the boys more than that of the girls. Okay, we can also diagnose by this plain X-ray here, that is abnormal Klein sign. Klein sign is drawn from the upper border of the neck of the femur going upward. If it goes outside the head, high head of the femur or ball of the hip joint, like this is abnormal Klein sign. In normal Klein sign, again a line drawn through the superior border of the femur. It cut a part of the lateral part of the ball, the epiphysis. Okay, this part, and this is normal and this is abnormal. This abnormal Klein sign is also called Treathwan sign. This is also called Treathwan sign. Okay, like this, it is going down, slipping down and medially here. Treatment of slip capital femoral epiphysis. Treatment aim to stabilize the femur and prevent further slippage, as well as alleviate pain and restore hip function. So we need surgery. We must consult with an orthopedic surgeon, with a pediatric surgeon. Okay, it should not be reducted closely. Okay, so we need surgery. Here is an indication of surgery. The most common treatment, often involving the placement of screws or pin to hold the femoral head in place. No weight bearing measures, using crutches or a wheelchair to avoid putting weight on the affected hip before surgery. So we must avoid putting weight. Physical therapy post surgery to restore strength and mobility. Okay, here we're seeing the screw has been placed here and X-ray has been taken after this surgery. This is the comparable to this. This is the neck of the femur, head of the femur, and screw is going through that below the greater trochanter of the femur. Okay, this is a treatment. It shows this. Okay. Prognosis of slip capital femoral epiphysis. With timely and appropriate treatment, many individuals with slip capital femoral epiphysis can regain good hip function. However, there is a risk of complications such as avascular necrosis, loss of blood flow to the femoral head, chondrolysis, loss of cartilage, early onset arthritis. Prevention. While slip capital femoral epiphysis cannot always be prevented, managing risk factors like obesity and monitoring growth and development can help in early detection and treatment. Okay. Okay, so that's all about the slip capital femoral epiphysis. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.